Sometimes in clinic, I observe a very interesting phenomena, which is patients that are head to toe covered in tattoos that tell me just before I'm about to pop a needle in that they're terrified of needles. And I think to myself, wow, well, thank you for telling me. Thank you for coming for acupuncture. I wonder how you went getting all those tattoos. But it actually makes me stop and think about the fact that needle sensitivity is very subjective and it's different from person to person. One of the big blocks that people have around trying acupuncture in the first place is that lots of people are afraid of needles. People hate going to the doctors and getting their blood taken. They hate getting injections. And rightly so, because a needle that a doctor is using, the thick hypodermic needle, is really big and scary and pinchy and it hurts. Acupuncture needles, however, are much, much thinner. And whilst they can be unpleasant and they can be painful even sometimes from person to person, they're nowhere near as intense as a hypodermic needle. I will also say, sometimes when I am needling people, we will find, me and the patient will find, that there will be certain points in their body where the body says, absolutely not, please don't needle this point. And I never, in those instances, force the needle in. I actually listen to that moment and say, the body is saying no to this point. This is not a point that we should be needling today, and I stop. And maybe that's the difference between experiences that some people have where the needling was really painful and they made a big remark that it was painful, but the acupuncturist continued. So needle sensitivity is a really important topic for me as an acupuncturist. Obviously, I'm putting needles into people's bodies. And I don't think that it should be a reason that deters someone from getting acupuncture. What I think is more important, that you have a sense of trust and rapport with your acupuncturist so that you feel safe when you are receiving your treatment.